painful periods or excessive painful periods. First of all, this painful periods is called dysmenorrhea. Dysmenorrhea is the scientific name or the medical name that we use to mean painful periods. So there are two types of dysmenorrhea. There are a lot of people who are going through this kind of life, and of late it has been so excessive that people are receiving too much painful periods that is hindering them, or that has hindered them from fulfilling normal activities like office work, activities like doing work, normal work, activities like doing even house chores, activities like doing exams or attending classes. At the end of the day, if this is done, such a person would end up getting depressed, would end up getting losing focus, would end up losing. Some people even lose jobs. Some people lose exams, miss exams. So it is very important for you to know about this topic so that you know what the problem is about it, because there is a solution to each and everything. Depending on the cause, there are two types of painful periods. So first of all, this painful period is called dysmenorrhea. Dysmenorrhea is the scientific name or the medical name that we use to mean painful periods. So there are two types of dysmenorrhea. By cause, there is what we call primary dysmenorrhea and secondary dysmenorrhea. Usually, the word primary and secondary, the word secondary means something that has happened because of the presence of another thing or an underlying condition. And then primary means there is no underlying condition that has brought about something to happen. So primary dysmenorrhea or primary painful periods is that kind of periods that someone will get the pain without any underlying condition, but because of certain factors. Factors like early menarche, when someone is born, when a woman or a girl starts her periods earlier, when a woman or girl starts her periods earlier, say at 8 years old, at 9 years old, at 10 years old, there are chances that this person or this girl will get painful periods. Then, how does this come about? How does this come about? In a woman's uterus, where the blood comes from, in the endometrium, there is a hormone. It's not even a hormone. There is a chemical called prostaglandin. Prostaglandin chemical is a chemical that aids, that ideally would help in aiding of one in the contraction of the uterus, so that there is that kind of ejecting out the blood, and two, narrowing of blood vessels, so that there is not so much blood that gets lost in the process of periods. However, when there is an excess of this chemical prostaglandin, a woman will get, or a girl or a woman will get what we call a narrowing of excessive contractions of the uterine muscles. The excessive contractions will lead to excessive constrictions of blood vessels. When there is excessive constriction of blood vessels, there is what we call tissue hypoxia. Tissue hypoxia means there is no blood supply to your uterus. Your uterus is not getting enough blood supply. And this will make you get so much acute or severe pain. So much. Remember, now we are still looking at primary dysmenorrhea, where there are no causes, but there is secondary dysmenorrhea, which we're going to look at, which has causes. So when you get tissue hypoxia, you get excessive pain. Sometimes it may be sharp, sometimes it may be blunting, sometimes it may be pulsating, depending on the extent, but you will get this excessive pain. Actually, this pain is comparable, or this pain is the perfect analogy for this pain is the pain of the heart, that people who are getting a heart attack or angina, that kind of pain they get is the same pain that you get down. Why? Because both of them, the heart, the people who have heart attack, angina, and all those diseases, it's the same mechanism, cutting off blood supply and tissue hypoxia, and pain arrives, pain arises. Okay. Now, in that kind of circumstance, you will get the pain. But however, there are solutions. that we are going to look at, in the next few minutes to this kind of problem. There is what we call secondary dysmenorrhea. I know most of you it's what you've been looking at. Secondary dysmenorrhea is what you've been waiting for. Secondary dysmenorrhea means painful periods that are coming because there is an underlying cause, because there is an underlying disease, there is an underlying disorder. And when there is this disorder, you're likely to get this kind of pain, even in a more severe way. And unless this kind of problem is treated, you might not get a relief. One of the characteristics of secondary dysmenorrhea is two of them is one, you get given this pain prior or before getting your periods. You get this kind of painful periods. So you get this kind of pain before even going into your periods. And sometimes even when you leave your periods, you may even experience this kind of pain. So you end up in that kind of confused state, because for all the time your lower abdomen is paining, including in the both periods, menstruation days, and out the menstruation days, your abdomen is paining. So, being that it's secondary, and we have seen that secondary means there is an underlying cause or there is an underlying disease, let us look at some of these things that aggravate or that lead to this secondary dysmenorrhea. One of the causes is what we call endometriosis. There are over 6 causes that we are all going to look at. There are about 6 causes that we are all going to look at, but one of the causes is called endometriosis. Endometriosis. The word endometriosis comes from the endometrium. So endometriosis means, you see these red circles, these are not supposed to be there in a normal female reproductive system. This is a normal female reproductive system. So this tissue ideally would have to be within here, within the uterus, this tissue. However, what happens, the endometrial tissue implants itself out of the uterus and goes externally. And since this tissue is by genotype is the same composition as the tissue that will go inside here, it means when the time for bleeding, the time of menstruation comes, instead of bleeding inside here, these tissues will initiate the bleeding phase, and you will end up getting that kind of excessive pain because these tissues are not where they are supposed to be. This can be seen if a good ultrasound scan is done, and to assess the kind, if there is vascularization, if there are no vascularization, and all those things. It can be done to assess and see if you have endometriosis. And it can be treated. It can be treated either medically or surgically. We have adenomyosis. Adenomyosis means the muscles that, because this is the normal uterus, like I can see normal uterus, adenomyosis. The normal uterus would ideally be like this. However, if the tissues that are supposed to not be anywhere within here, or the tissues that would be on the endometrium here, starts implanting themselves within the uterine muscles, intermediate within the uterine muscles, you will end up getting that kind of excessive pain during your periods. Why? Because when the bleeding starts, instead of bleeding outside, the bleeding will be happening within here, within inside. The bleeding will be happening within inside. And then also, since there are tissues, these are tissues inside that are not supposed to be there. Remember, periods or menstruation comes with contraction, what we call cramping. So whenever there is these internal muscles and the cramping happens, you end up getting irritated. You end up getting irritated within the process. So the pain would be extremely expected, and it would happen. The other reason and the other condition, this can also be seen using an ultrasound scan and some hormonal tests to see, because usually they are hormonal triggered. It can be done and it can be assessed, and it can also be treated either surgically or medically. There is what we call ovarian cyst. Ovarian cyst is also one of the causes of the extreme painful periods. Why? Because this is the normal ovary. The ovary is the organ in your body that produces eggs, so that they get fertilized and you get a baby. The normal ovary would be of this size, and the egg comes from here, it moves to the ampulla where it gets fertilized, and then it moves, it descends down and gets implanted here. However, in some people who have an ovarian cyst, the one that will be like this changes like this. Why? A cyst is like a pocket or a pack of water in a polythene bag or in a polythene. So an ovarian cyst, the ovary, either whole of it or part of it, becomes encapsulated, becomes filled with fluids, and it is very painful since there are contractions during the process of menstruation. This can also be done, this can also be assessed and seen, and it can also be treated. It can also be treated either surgically or medically, depending on the type, because there are several types. There is follicular cysts, there is uterine cysts, there are chocolate cysts or hemorrhagic cysts. So there are a number of them, depending on the cause and the location and the size. And I've made a video about cysts, which you'll go and see. And no, because there are a lot of questions that always come saying, I've been diagnosed with a cyst, what can I do? You go and watch that video. It has all the full details about the cysts. However, it can be managed and treated. There is endometritis, not endometriosis, but endometritis. There's a difference between endometriosis and endometritis. This one ends with tritis, which means infection or a disease. Endometritis means the endometrial tissue, the endometrial tissue or the endometrium becomes infected, hence getting inflamed. Okay, what does it mean? It means it gets infected with bacterial diseases, and you end up getting diseases like PID down in your uterus, in the upper centers of the reproductive system, and in a long run it becomes very painful. It's more like you're squeezing a wound during the process of menstruation. Imagine squeezing a wound, the kind of pain that you would get. So it's important to analyze, to assess, and this endometriosis, it can be treated. It can be treated and you get very much well. Within a week or a few days, you get it treated and you get well. And this one does not even require surgical management, unless if it has gone extreme or it has brought other secondary effects. But otherwise, endometritis, it can also be managed, but it's also one of the causes of the painful periods. Uterine polyps. Uterine polyps is also one of the causes. Like you can see, these are swellings that even have a stem. Swellings with a stem. Most people, because you can see this one, clinically it looks like a penetrated fibroid. Clinically, they might be misdiagnosed for fibroids, but ideally they are polyps. They are also due to disorders in the uterus, and they can also be managed. An ultrasound scan can be done. It can be seen. We see if there is vascularization or not. We see the extent, and it can also be managed, and you get very well, and the pain goes away in case it's the one found to be the problem. There is what we call uterine fibroids. Uterine fibroids are also one of the causes of the excessive periodic pain. Why? Because fibroids are like masses. I have made a video about fibroids, describing fibroids and how they come about and what brings them and the risk factors to getting them. So you may go and watch this video and get more clear details or more details. However, fibroids are, by definition, are benign or non-cancerous masses within the woman's uterus or reproductive system. So these masses are not cancerous, they are not cancers. However, they are swellings that can also be managed, but they are also one of the leading causes of the excessive period pain. Sometimes all these things that we've looked at may also come with heavy bleeding or prolonged bleeding or excessive bleeding with excessive pain. So before you attempt considering this as a primary cause, because we have seen primary dysmenorrhea and secondary dysmenorrhea. Primary dysmenorrhea can be managed at home or at hospital if it goes to extremes. However, if before you confirming, you need to do a thorough investigation and examination to understand exactly what the cause is, and then you treat accordingly. Now, if we are to look at the management, how do we manage this kind of extreme period pain? We have two types of managements. One, home care management or hospital management. Usually, if it is primary dysmenorrhea, it can be managed at home with some medication and some lifestyle adjustments. For example, when you do exercises during the process of menstruation, your body releases some chemicals, what we call endorphins. When endorphins are relieved, in fact, endorphins are also called endogenous or endogenous morphine. In fact, when they are released, you get that kind of relief from the pain. So that means it's not good to live a sedentary lifestyle when you're in periods. It's not good to sit or not do exercises when you're not in periods. When you're in periods, it is important you move around, you do some exercises so that you circulate your blood. That is one thing. Then two, there is what we call medicines. You can take NSAIDs, and NSAID that is gastric protective. Not all NSAIDs are gastric protective, but when you take an NSAID that is gastric protective in a combination with a smooth muscle relaxant, the way you see Drotavarin, the way you see Hyoscine, a combination of an NSAID and a smooth muscle relaxant will help ease the pain so much if it is primary dysmenorrhea. Also, when you're taking these medicines, you have to ensure that one, you don't have gastric ulcers, or gastritis. Two, you're not asthmatic, and then three, you don't have platelet problems or bleeding disorders, hemophilia, and all those other things. So ensuring that those three factors are in place. And for example, if you have ulcers and you want to take NSAIDs, you have to ensure that you take an NSAID with medicines that have what we call protein pump inhibitors. So it's important for you to know that when you take pantoprazole or rabeprazole or omeprazole with an NSAID to someone who has ulcers, it becomes better, because when you take NSAIDs without taking any of those, it will increase or aggravate your ulcers, since NSAIDs will lead to excessive production of hydrochloric acid through still prostaglandin and other cascade of physiology that happens. So, what is the management of secondary dysmenorrhea? Secondary dysmenorrhea that contains all these things that we have looked at. The management will usually depend on what the problem was. The problem is depending on all the things that we have looked at. So, depending on what the problem is, the treatment will be given to you either medically or through injections, through swallowables or injections, or intrauterine devices, or surgical management. But all in all, there is always management of these conditions. There is always management of these issues. And when you treat, you will get the relief from the pain. So, that is why it is important for you, before you opt for this, you need to do a proper or thorough medical checkup, specifically or with objective oriented, to know exactly what the problem is, so that you treat accordingly. Thank you very much. You can go and watch our other videos, which have already been posted, and some of them are going to be posted. So when you press that notification button, you will be updated in case of anything. Who knows, you could find a video that is very important for you, that can change your life or your loved ones or your friends and all the people around you. Thank you.